All right, so this is my millionth time trying to record this thing. I'm at home for the holidays, and oh my gosh, it's been difficult. But Merry Christmas to everybody, anybody who's watching this. The goal of this series is to go over all the medical topics in a free online software or system, so that anybody can, you know, do these things for free because I hemorrhaged tons of cash while in medical school paying for resources, and I hope other people don't have to do that. I have a whole list of things I've made, these mind maps. I have tons of them for cardiology, everything else. So I'll eventually make them out for every system. But for today and for the next couple weeks, I'm going to go through bacteria pretty slowly. And eventually, I will also publish all of these things online. There might be some small donation, like $5 for them or whatever, because I have, a couple hundred grand in loans to pay. But all the videos obviously are free. So okay, let's go through it. And I might have to glance over throughout this thing because my screen recording software is not working with me. So I need to see on this huge TV I put next to me what I'm looking at. But anyways, um, so let's start with, we're going to do Staph aureus today, and that is a gram positive. So if we go into this sheet, I've got them broken down. Now we're going into cocci today. That's these circular little guys. And we open this up and we have, let's zoom that out. We are looking at, if it is a cocci, it's going to be anaerobic and facultative. Um, and since we're talking about Staph aureus alone today, it's going to be catalase positive. Um, Staphylococcus is going to be in these grape-like clusters. That's a key that you're talking about staph. And specifically for Staph aureus, you should know that it's coagulase positive. So these are kind of identifying characteristics. Now let's jump into Staph aureus proper. So let's start with its diagnosis. This is so difficult. Why do you want to fight me so much? Um, I'm sorry, people. Uh, Obviously, you're going to be watching this at 2 times speed anyway, so maybe not as big a deal. But here we go. So, diagnosis. So, key catalase positive, coagulase positive, and that coagulase is important for converting fibrinogen to fibrin. It's beta hemolytic, as you can see here on this nice plate, and it ferments salt agar. This should be the other way. It's going to turn mannitol salt agar yellow. Next, let's talk about its virulence factors. So I know this is going to seem like a big old list, and that, come on. Okay, I know this seems like a big old list, and that might seem scary, but I promise it's not going to be that big a deal. And as we go through them, I'll point out the important parts. So let's start with the polysaccharide capsule. So polysaccharide capsule is there to prevent phagocytosis. It promotes adherence to host cells and prosthetics. Think in particular prosthetic valves. Next, you have peptidoglycan. Peptidoglycan in the bacteria is important in creating a bacterial cell wall rigidity. It also activates the complement cascade. Then you have Genotic acid. I can't pronounce that word. I'm sorry. Uh, we can't be perfect. Um, but the important thing here is that this helps with adhesion, colonization, cell division, and biofilm production. D-alanine or D-ala residues are what help to create resistance to cationic antibiotics, think vancomycin in this case, and this is in this acid. There's 2 types, LTA and WTA. I wouldn't worry so much about the types. Um, yes, it is going. Uh, I wouldn't worry so much about the types, but the real difference between them is where they are in the bacteria. LTA is in the cytoplasmic membrane, and WTA is covalently linked to the peptidoglycan in the cell wall. The key here is to remember that it's D-ALA in these, and it helps with antibiotic resistance. So this is the most important one by far. This is protein A. Sorry, Jacob. It's it's the holidays, so we have lots of people home, obviously. So I'm sneaking away on Christmas Eve to do this. But anyways, protein A, if this allows me to look at it, we're gonna see. It's saying no. Okay, well, the important part about protein A is that it binds to the Fc portion of immunoglobulin. That's really key. This stops complement from occurring, and it prevents phagocytosis and opsonization. Um, it's also key in helping to create biofilm formation, but really focus on that immunoglobulin. A couple other fun facts about it is it facilitates adherence to von Willebrand factor coated surfaces, and that's how these bacteria can adhere to endovascular catheters. And it's really important in development of pneumonia. I doubt you're going to get a question about this, but it is a big deal because protein A is what's causing the inflammation. Um, in the lung by binding to tumor necrosis factor 1, and that's what helps to cause pneumonia. Next, we have the fibronectin binding proteins. So these help to make biofilm. They're especially important in MRSA. There's two types, but don't worry about the types. Just know that they help with creating that biofilm. We also have collagen binding protein. Again, it's a cell surface adhesion protein, and it's helping Staph aureus to bind to the host cells. Next, we have the extracellular toxins. So, big long list here. Don't let it stress you out. We're going to go through them one at a time, and it won't be that big a deal. Cytolytic toxin. So this helps with this is a hemolysin. I'm so sorry, guys. It'll get better, I promise. This allows you to lyse red blood cells. And there's a bunch of different types, but don't worry about it. The important thing is you're lysing red blood cells. Leukocidin. So this hurts polymorphonuclear leukocytes, and it causes necrosis. It's got a cytotoxin component to it, and PVL is what's going to help it cause pores to form and target cells. So it's essentially killing cells. Next, we have the enterotoxins. So the enterotoxins are very important. Really, if you hear enterotoxin, think heat-stable toxin and think food poisoning. When you get food poisoning from Staph aureus, it's not the bacteria that's causing the problem. It's that the bacteria has grown in that food and all these toxins have built up. And even though you've reheated the food or heated up the food, these toxins are there. So you eat the food, you ingest the toxin, and you get sick. There's lots of different types of this toxin or these toxins. I wouldn't worry about them. Just know they're heat stable. And as just a fun fact, toxic shock syndrome toxin used to be considered an enterotoxin, but now it gets its own category. But once upon a time, it was one of these guys. And finally, for the extracellular toxins, we have the exfoliative toxin or epidermolytic toxin. So this is a serine protease. It splits desmosomes and breaks their intercellular bridges, which in the stratum granulosum, and this causes scalded skin syndrome. It's a huge issue in infants. I bet you will see this on your pediatric rotation. There are two types of it, ETA and ETB. I wouldn't worry so much about the types, but you should definitely know this. It's a very important toxin. Next, we have toxic shock syndrome toxin, which we kind of mentioned earlier, but didn't really go into. But here we go. We're going to go into it now. It's a super antigen. That's very key to know. It induces cytokine release from macrophages and T cells. That's very key. It can actually create a cytokine storm, which we'll talk about later. It also helps to enhance the toxic effects of endogenous endotoxins. It creates leakage in endothelial cells, and it helps to penetrate the mucosal barrier, so it helps with furthering the infection. But really think of, when you hear toxic shock syndrome toxin, think super antigen and think, this is going to cause a cytokine storm. And finally, for valence factors, we have the enzymes. Again, big long list. Don't stress about it too much. We're going to go through it one by one. But coagulase, we alluded to earlier, very important for staph. It activates the coagulase reacting factor, or CRF. It causes clotting by converting fibrinogen to fibrin. It coats the bacterial cells with fibrin, and now they can resist that opsonization and phagocytosis. Staphylokinase, or fibrinolysin, is important as well, but it might not come up all that much, but I think you should know it, especially for pimping questions. Um, but it's different from streptokinase, which I'm sure you've heard of. This is a whole different molecule, a whole different mechanism. It has fibrinolytic activity, so it's actually breaking down those clots that were formed earlier. And this is kind of later infection in the infection. It's helping the infection to spread through the bloodstream. Um, Hyaluronidase is there to break down hyaluronic acid, which is a very important component in your connective tissues. It's also on your heart. And this again helps to spread the infection, but this is more of a local infection spread sort of thing. It's breaking down those connective tissue barriers and helping the bacteria move from space to space, adjacent space. The next one's not super important, but you should probably at least have heard about them. You've got deoxyribonuclease, it degrades DNA. You got lipase, it degrades lipids. You've got phospholipases, it degrades phospholipase. And you've got proteases, which, as you can guess, causes proteolysis or degrades proteins. All right, so we have officially covered all of the virulence factors that are at least big and important. We've pretty much covered all of them in general, but we've definitely covered the important ones for Staph aureus. Now let's talk about the location. So you can get Staph aureus anywhere, but domestically, normally, it's colonizing your nose. It's not going to cause a problem there. It just lives there. That is what it does. But yeah, no, it's in your nares. Next, clinical. So Staph aureus can cause a bajillion clinical things, but we're just going to go through the big ones right here. First off, pneumonia. It's going to cause a patchy infiltrate on chest x-ray. Then you've got septic arthritis. The key thing to know here, and this will be very important on Family Med, is it is the most common cause of septic arthritis in adults. If you hear of an adult with septic arthritis, the first thing in your differential should be Staph aureus. Next, you've got skin abscesses. This is self-explanatory. Then you have endocarditis. So for your differential, if you have someone who's had heart problems for a while, you're talking about like a month or something, you should be thinking more along the lines of like spirochetes, like Lyme, something else. If it's Staph aureus, they're getting sick really quickly. And it's going to be this rapid onset acute endocarditis. Don't think months, think like days. It's associated with IV drug use, and this is kind of key to where you're going to find it. And if you're thinking about a murmur, so when someone's injecting themselves with IV drugs, that's going through the venous system, and the first valve that's going to come back to the venous system is going to come back to, and those bugs are going to come back to, is the tricuspid valve. So this is considered a right-sided endocarditis. Now you could have it on the left side, obviously, but if you hear in a boards question or something, a right-sided endocarditis that came on fast, you should be thinking about Staph aureus. Next, we have osteomyelitis, and the key thing here is that this Staph aureus is the most common cause of osteomyelitis in adults. You'll definitely be asked that. Know that this is probably the one. Toxin-mediated diseases. So we're going to go into a little bit more depth. Not a lot, but a little bit more depth on those virulence factors we talked about earlier, or at least the key ones. First off, scalded skin syndrome. So this is mediated by a protease, as we mentioned earlier. The skin starts to peel off. It's pretty horrific looking, and you're probably going to see it on some infants in pediatrics. It's very sad and very dangerous. Toxic shock syndrome, as we talked about earlier. This usually comes from leaving foreign packing in for too long. And think of a woman who leaves a tampon in for too long, or post-surgery, they leave the gauze in too long, the patient isn't changing their gauze, or the nurses aren't changing the gauze very often. You're going to see, you might see toxic shock syndrome. In terms of its pathogenesis, it's a superantigen, as we mentioned earlier. It has nonspecific binding to the MHC2 portion of T cell receptors, and it creates this cytokine storm that we mentioned earlier. Also, guys, I would love to include videos for this, but I don't want to get, copyright struck by YouTube. So if I'm allowed to, I will do it. But for now, right now, they won't be there. But I'll include tons of pictures in the downloadable format of these files. Finally, the last toxic syndrome you're going to see is, or toxin syndrome you're going to see is food poisoning. As we talked about, it's those enterotoxins. It's going to create rapid onset, and think hours. Like, this is someone goes to a picnic, they eat the reheated food, and they are vomiting within hours. Vomiting is key here, and think of meats and cream-based foods, and also sauerkraut for some reason. Every test likes to include sauerkraut for Staph aureus. I don't know why. So a special type of Staph aureus is called methicillin-resistant Staph aureus. This is resistance to methicillin, which is a penicillin drug, and it's caused by the bug mutating and altering its penicillin binding proteins, or PBPs. The PBPs are important in the cell walls, and obviously once they're mutated or altered, now you have resistance. And finally, treatment. So, if you have MRSA, which we just talked about, you want to go for vancomycin. Bring out the big guns. If you have normal Staph aureus, you want to do methicillin sensitive Staph aureus, or just normal. You want to use penicillin-based drugs. Think nafcillin, or as the classic saying goes, NAF for staph. And that is Staph aureus. Eventually in this series, I want to go through all of this. And as you can see, I have them for literally every bug you could possibly imagine. So this might take a little while, but eventually we'll go through all of the bugs. And yeah, hopefully people out there have a free resource to study with. Thanks so much for listening, and I hope you guys have a very Merry Christmas or Happy Holidays, everything else. All right, bye.